Hello, my name is Alyssa and I'm a third year paramedic student at Queensland University of Technology. I will be discussing interprofessional communication with a focus on clinical handover of a patient to the emergency department. Interprofessional communication in healthcare is the communication that involves a wide range of health providers, including doctors, nurses, paramedics, social workers, and physiotherapists. Effective communication between the healthcare providers, patients, and their families promote an environment that supports an open and collaborative experience and provides the highest level of patient safety. Successful interprofessional communication is facilitated by active listening skills, paying attention to non-verbal communication, coming to an agreement regarding best care decisions, and effectively using information and communication technology. Clinical handovers form part of interprofessional communication and are defined as when professional responsibility and accountability for a certain aspect or all aspects of a patient's diagnosis, treatment, or care is transferred from one or several healthcare professionals on a temporary or permanent basis. Clinical handover is a frequent event that follows patients through their whole journey in the healthcare system. Starting from the handover from the paramedic to the emergency department triage nurse, to the bedside handover in ED, or depending on the acuity of the patient, handover to the resuscitation team. Handover will continue when the patient transfers to the ward or if they require transfer to multidisciplinary teams such as radiology, social work, or physiotherapy. Clinical handover is multifaceted and at the mercy of many different factors to ensure success. Safe handovers have been shown to require information regarding a patient to be accurate, complete, relevant, and timely. The World Health Organization, as well as the Australian Commission for Safety and Quality in Healthcare, have recognised that patient safety through skilled communication during handover is a priority and of international importance. Due to the differences in professional language and training used by doctors, nurses, and paramedics, makes interprofessional handover particularly vulnerable to adverse effects and poor patient outcomes. Many studies have shown that the use of a standardized handover communication tool, such as the widely used SBAR mnemonic, assists all healthcare providers involved in the patient's care to organize pertinent information in a clear and succinct format to encourage collaborative communication and accurate transfer of information among healthcare providers. SBAR stands for Situation, Background, Assessment, and Recommendation. Situation provides the healthcare professional giving the handover an opportunity to provide a concise statement regarding the patient's presenting problem. Background allows for pertinent information relating to the situation. Assessment is the health provider's assessments, analysis, and considered options with the recommendation section for the recommended action for the patient's ongoing care. The Queensland Ambulance Service currently encourages the utilisation of the I-MIST-AMBO mnemonic for clinical handovers. This stands for Introduction, Mechanism of Injury or Medical Complaint, Injuries or Information Relevant to the Complaint, Signs, Treatment and Trends, Allergies, Medications, Background or Previous Medical Conditions, and any other issues. By following this structured handover, it promotes the fostering of two-way communication between the paramedic, nurses, and doctors in the emergency department. While noise, chaos, and interruptions are always to be expected in the ED, following a concise handover structure helps to eliminate the chance of adverse patient outcomes and mistakes made due to miscommunication. Research shows that there are several elements of a clinical handover that will ensure the best possible outcome with the least chance of adverse effects for a patient. A handover performed by a paramedic in the emergency department is best received when the paramedic appears confident in what they are saying, are clear and concise with only relevant information given, advocates for the patient, and is structured by using a communication tool such as SBAR or I-MIST-AMBO. An effective handover should be one where the paramedic determines the critical information that is required to be communicated face-to-face and which covers everything that is needed to safely transfer care of the patient in a timely manner. If the patient acuity allows for it, during a resuscitation room handover, a hands-off handover has also been proven that clinical handovers are more widely listened to with less interruptions or distractions. All members of the receiving team are present and focused on listening to all aspects of the handover as the patient remains on the paramedic stretcher, rather than transferring the patient onto a hospital bed prior to giving handover. This ensures nurses and doctors are actively listening rather than talking to each other, the patient, or trying to gain IV access like take a blood pressure or an ECG. So what happens when a handover goes wrong? It has been well documented that poor communication and inadequate patient handovers lead to adverse patient outcomes and can cause unnecessary harm to the patient. It can cause a delay in required treatment, or treatment is given that is not required, multiplication of blood or diagnostic tests, medication errors, injury to the patient, or most concerning, death of the patient. A study has found that over 33% of adult hospital admissions experienced a clinical error, with 58% of these errors preventable. It was found in this study that the greatest reason for errors was that of ineffective communication. Barriers to give an effective handover in the ED can include not enough information, poor quality of information, frequent interruptions, and a limited opportunity for two-way discussions and to ask questions. In the fast-paced environment of an emergency department with multiple handovers per patient, it is crucial that paramedics utilise a structured and organised handover tool to prevent errors and reduce morbidity and mortality of patients. The continuity of care of a patient is at most risk during the time of paramedic handover. Emergency department handovers are particularly vulnerable to errors and adverse events due to several factors. The patient is usually much more acute than ward patients. The patient is generally not known by the doctors or nurses and have a shorter encounter time with uncertain medical complaints and situations, as well as overcrowding and chaos of the emergency department. Literature has well documented that unstructured or disorganised handovers, frequent and varied distractions, insufficient documentation, and lack of training with poor handover skills all contribute to a poor handover. The Institute of Medicine has identified poor handovers as one of the leading causes of error in medicine in the emergency department. In conjunction with disorganised and frenzied handovers come the pressures of offloading a patient off the paramedic stretcher in order for the paramedics to get back out on the road and meet statewide response time targets. This can lead to increased pressure on the paramedic to give a quick or shortened version of the handover which has not been prepared adequately or has omissions or mistakes. Healthcare staff of the ED feel this can lead to poor quality care, which puts patients at risk of adverse events and mistakes. In order for a handover to be well received with the doctors and nursing staff having a full understanding of the patient's condition, it is imperative that the receiving staff are able to grasp the whole story while painting a full picture. When the receiving staff have the full picture of a patient's condition, they are better equipped and able to quickly recognise changes in the patient's status and when a patient is deteriorating or to anticipate any risks. This then allows for a quicker response time and promotes better patient safety. It is important that all healthcare providers have patient-centred care at the forefront of their work. Involving patients and their families in their handovers is one way to achieve patient and family-centred care and is also proven to be an effective handover strategy. In 2017, the Joint Commission published a Sentinel Alert event, which was titled Inadequate Handoff Communication, or Inadequate Handover Communication. This alert reiterated the expectation of standardised handover to ensure the utmost patient safety with the addition of engaging patients and their families during handover wherever possible. Research shows that there have been many benefits identified when incorporating patients and their family into handovers. When the situation allows for a collaborative handover with the patients and families, patients report there is higher patient satisfaction. They perceive they are receiving better quality care, and with healthcare providers having an increased understanding of the patient's condition. Several studies have found that patients and families have an increase in trust and felt that their needs were better respected by staff. It has also been found that bedside handovers give patients improved outcomes, such as less medication errors and less patient falls. Nurses have also reported that handover takes less time to complete when performed at the bedside, as there are less interruptions when the patient and family are incorporated. To conclude, it has been well documented and researched about the importance of interprofessional communication, which leads to effective handovers of patients between paramedics and the receiving staff in the emergency department. Following a standardised handover tool such as SBAR or IMIST AMBO allows the handover recipient to clearly see the full picture and grasp the whole story of the patient's presentation. Succinct and accurate handovers have been shown to reduce adverse effects, improve patient safety, and minimise harm by miscommunication, leading to better patient outcomes. It has also been shown that patients and their families should be included in handovers wherever possible, as this increases trust, respect, and lowers the risk of errors. Thank you.